Hey guys, we're going to review chapter 14, discussing organizing patient care. The primary means of organizing nursing care for patient care delivery include total patient care or case method, functional nursing, team nursing, modular nursing, and primary nursing. Organizing patient care is best seen as there is no one best model for organizing patient care. Many of the newer models of patient care delivery systems are merely recycled, modified, or retitled versions of older models. Changing the patient care delivery model questions the change agent must ask include: how will the reorganization alter autonomy in individual or group decision making? How will social interactions and interpersonal relationships change? Will employees view their unit of work differently? Will the change require a wider or more restricted range of skill and abilities on part of the caregiver? Will the redesign change how employees receive feedback on their performance, either for self-evaluation or by others? And will communication patterns change? Total patient care or case method nursing. It is the oldest model of organizing patient care. This is where nurses assume total responsibility for meeting the needs of all assigned patients during their time on duty. It is sometimes referred to as the case method of assignment because patients may be assigned as cases. It is still widely used in hospitals and home health agencies. So this is the diagram for total patient care. So you have your charge nurse that's over your nursing staff, and then they each are assigned to their patients. Disadvantages of the total patient care is the greatest disadvantage is the delivery occurs when the nurse is inadequately prepared to provide total care to the patient. Functional method of nursing has evolved as a result of World War II. This uses relatively unskilled workers who have been trained to complete certain tasks. Care is assigned by task rather than by patient. So this is kind of how that model would look. So you have a charge nurse, and then you have an RN that would just give medications, an RN that would provide treatments, your nursing assistant, slash like hygienic care, so someone doing baths and that kind of thing, and then your clerical housekeeping. So they all have separate duties for that one patient. Everybody works as a team for that patient, but everybody has a clear focus. Advantages and disadvantages of functional nursing include the major advantage is its efficiency. Tasks are completed quickly with little confusion regarding responsibilities. However, it may lead to fragmented care and the possibility of overlooking patient priority needs. Because you think about it as the nurse taking holistic care for that patient, you are looking at everything and can catch things. If all you're focused on is giving a medication, you may not realize the knowledge deficit that the patient has on their disease process. Team nursing includes ancillary personnel that collaborates in providing care to a group of patients under the direction of a professional nurse. It requires extensive team communication and regular team planning conferences. It allows members to contribute their own special expertise or skill. The disadvantages are associated with improper implementation rather than the philosophy itself. So you have your charge nurse that then has team leaders that report to them, and that team leader then has nursing staff under them, and each nursing staff has a patient. Modular nursing is the modification of team and primary nursing. This is similar to team nursing but uses a smaller team. So pairs of professional nurses with ancillary staff to deliver care to groups of patients. It was used frequently in the 80s and 90s. Primary nursing / relationship-based nursing uses some of the concepts of total patient care. It brings the nurse back to the bedside to provide clinical care. It can succeed with a diverse skill mix, just as team nursing or any other model can succeed with all RN staff. Job satisfaction is high. However, this method is difficult to implement because of the degree of responsibility and autonomy required of the nurse. Disadvantage is primarily in improper implementation. Case management nursing is where a collaborative process that assesses plans, implements, coordinates, monitors, and evaluates options and services to meet an individual's health needs through communication and available resources to promote quality, cost-effective outcomes. It coordinates care through an episode of illness. The focus is on the individual client, not populations of clients. And some feel that the role of the case manager should be reserved for the advanced practice nurse or RNs with advanced training. So this is where clinical nurse specialists as advanced practice nurses are utilized a lot in the case management model. So what is the oldest model of nursing? Modular nursing, A. B, total patient care, C, primary care, or D, case management. That's total patient care, B. Total patient care or case method care is the oldest method of nursing care. What kind of care uses relatively unskilled workers who have been trained to complete certain tasks? A, modular nursing, B, case management nursing, C, functional nursing, or D, team nursing. That is C, functional nursing. It was developed during World War II, and it makes use of unskilled but trained workers for some tasks. Disease management is also known as population-based healthcare and continuous health improvement. It is a comprehensive integrated approach to the care and reimbursement of high chronic illnesses. The goal is to address such illnesses or conditions with maximum efficiency across treatment settings, regardless of typical reimbursement patterns. A continuum of chronic illness care is established that includes early detection and early intervention. This is used a lot with CHF. So those with congestive heart failure are a huge population-based healthcare that continues to be worked on, and it's a chronic illness that patients often will come to the hospital for when they go into fluid overload and has a very high readmission rate. So there are many clinics set up that would be outpatient care for those with CHF, and nurses will actually, and case managers will call and manage patients after they've left the hospital to ensure that they understand their diet restrictions, they're doing their daily weights, and managing their medications correctly. This helps the patient be able to stay out of the hospital longer and reduce readmission rates and just have better outcomes overall for the patient. Common features of disease management progress: they provide a comprehensive integrated approach to the care and reimbursement of common high-cost chronic illnesses, focus on prevention as well as early disease detection and intervention to avoid costly acute episodes, but promote comprehensive care and reimbursement. Target population groups rather than individuals, employ a multidisciplinary healthcare team, including specialists. Use standardized clinical guidelines, clinical pathways, reflecting best practice research to guide providers. They use integrated data management systems to track patient progress across settings and allow continuous and ongoing improvement of treatment algorithms. Frequently employ professional nurses in the role of case manager or program coordinator. Chronic illnesses often managed with disease management protocols. Cancer, acute otitis media, diabetes, hyperlipidemia, asthma, hypertension, COPD, hormone replacement therapy, AIDS, stroke. Other primary features of disease management programs include the use of multidisciplinary healthcare teams, including specialists in the area, the selection of large population groups to reduce adverse selection, the use of standardized clinical guidelines pathways, reflecting best practices research to guide the provider's practice, and the use of integrated data management systems to track patient progress across care settings and allow continuous and ongoing improvement of treatment algorithms. Managing care with case management. Case managers often manage care using critical pathways and multidisciplinary action plans of patient care. The care map is a combination of critical pathways and a nursing care plan, which indicates times when nursing interventions should occur. All healthcare providers follow the care map to facilitate expected outcomes. If a patient deviates from the normal plan, a variance is indicated. Selecting the optimum mode of organizing patient care. The model should be based on patient acuity and not economics alone. The knowledge and skill required for particular activities with specific populations should always be the true driver to determining appropriate care delivery models. Not every nurse desires a challenging job with the autonomy of personal decision making. Please show leadership video case study. You can go to the point here, click on this link in your PowerPoint guide and on the actual PowerPoint slide and watch the leadership case video guide. Common themes found among emerging care delivery models. Evaluating the role of nurses in transitioning from caregivers to care integrators. I just want to make sure I explain that well. So because I'm in this, I can't really click to it, but when you go to your PowerPoint slides that are posted on the site, you can copy and paste that link and can watch that video. And it talks about prioritization of outcomes. Common themes found among emerging care delivery models are evaluating the role of nurses and transitioning from caregivers to care integrators, taking a team approach to interdisciplinary care, bridging the continuum of care outside of the primary care facility, defining the home as a setting of care, targeting high users of healthcare, especially older adults, sharpening focus on the patient, including an active engagement of the patient and her or his family in care planning and delivery, and the greater responsiveness to the patient's wants and needs. Leveraging technology, and then improving satisfaction, quality, and cost. Newer healthcare delivery models and nursing roles include nurse navigators, and this is where you have usually bachelor's prepared nurses that will look at certain disease processes and follow the patients outside of the hospital setting, making sure they follow up with their patients. You have clinical nurse leaders that can be resource nurses in the acute care or critical care setting, and then nurses working in settings that embrace patient and family-centered care. So the clinical nurse leader is the experienced nurse. They have a graduate degree. It's a master's degree in clinical nurse leader role. Their clinical leadership of all healthcare settings, outcomes-based practices. They're really looking at evidence-based practice and trying to have better outcomes for their patients. They work on quality improvement strategies. They review clinical practice. They create and manage microsystems, and they are responsive healthcare needs of individuals and families. The clinical nurse leader is not considered an advanced practice nurse. They are considered a leadership role with a graduate degree, and it is nurses with experience that can a lot of times be used as resource in different areas of the hospital and work on different projects. Core concepts of patient and family-centered care. Patient care is organized around the needs of patients. Patient and family perspectives are sought out and their choices are honored. Healthcare provides communication, but openly and honestly with patients and families to empower them. Patients, families, and healthcare providers collaborate regarding facility design and the implementation of care. The voice of the patient and the family are represented at both the organizational and policy levels, as well as in the health system strategic planning. Which of the following is a core concept of patient-centered care? Patient care is organized around the needs of the nursing staff. Patient perspectives are sought out and patient wishes respected. Healthcare providers do not seek open communication with patients. Or D, the voice of the patient is not represented in the planning. The answer is B, patient perspectives are sought out and the patient wishes respected. In patient and family-centered care, patient care is organized first, foremost, around the needs of the patients. Healthcare providers seek open communication with patients, and the voice of the patient and family are represented at both the organization and policy levels, as well as in the health system's strategic planning. Characteristics of effective healthcare delivery systems include elements of various designs present in the system in use in any organization, facilitate meeting the goals of the organization, they're cost effective, they satisfy the patient, they provide role satisfaction to nurses, they allow implementation of the nursing process, and they provide adequate communication among healthcare providers. That's it for chapter 14 and unit 4. Have a good week, guys.